air, food, water, and thought into healthy tissue. This is a patient we had recently. She came in, our clinic's in the Atlanta area, but she came in, she actually was from Florida. She came in with systemic lupus erythematosus. That's an autoimmune disorder. She had been to rheumatologists and she had been to chiropractors. So when we saw her, I saw her, my question in my mind, what is it about this young lady, was she, Dave, about 27? Yeah. 27 years old, that was not allowing air, food, water, and thought to be transformed into healthy immune cells. And because of an unhealthy immune system, one that was overactive, she was getting all this facial disfigurement and joint pain and swelling, a lot of autoimmunity. So when we figured that out, we figured out how she needed to be reconnected to the earth, to the planet, you see the transformation that goes on there. And that's what I'm talking about. This is a transformation process. How do we transform unhealthy cells into healthy cells? See, she's smiling there. See? This is a gentleman that came in to see us from Dahlonega, Georgia recently, about a year and a half ago. And he had a condition, you know, they gave it a name, pityriasis rubra-pilaris. Fancy name. And they wanted to put him on Remicade, which is a TNF alpha blocker. It's an immune suppressant drug. They use it for all types of autoimmune disorders. And I looked at him and I said, what is it about this gentleman that's not allowing air, water, food, and thought to be transformed into healthy skin and to healthy immune cells? And when we figured that out, we're able to transform him so that the outward manifestation, what you're seeing here is the outward manifestation of health is able to manifest. This fellow has an autoimmune skin disorder. What is it about his system that was not transforming air, water, food, and thought into healthy tissue? And we figured that out on an individual basis. The person has health. And this fellow has an autoimmune condition that was allowing his skin to peel from his hands. And we figure out what is it about this gentleman that doesn't allow air, water, food, and thought to be transformed, see the same question, into healthy tissue, and we have healthy tissue results from that. Okay. Now this is a typical patient for our office, and I don't think our office is unique in that. A lady somewhere between the ages of about 25 to about 75 or 80 that comes in, and, you know, our office, like most offices, see more women than we see men because women are smarter than men. And the men we see are usually there because the woman drags them in there because they're near death, right? The women usually come in because they're smarter, they get there earlier. But this is a typical scenario. She's looking for some type of a fix for her problem. And the people that write all the diet books, well, the diet might have worked for them, but it may or may not work for you. They can only talk in generalities. And not everybody's problem is related to diet. See? And 11 years ago when I spoke to this crowd, I said one of the errors that hygienists make is they focus sometimes too much on diet. And the rest of the population perhaps doesn't focus enough. Because health has many, many aspects to it. But even diet alone, you know, there's so many different ones. People try different diets for their chronic disease problems. They do the Fit for Life diet, the fruitarian diet, the Weight Watchers diet, the vegetarian diet, the vegan diet, McDougall diet, the Salisbury steak diet, the world's best diet, the anti-yeast diet, the body ecology diet, the grapefruit diet. How long do I have? Banana diet, the Sugar Busters diet, the high-carb, low-fat, low-carb, anti-aging, low-protein, high-carb zone diet, South Beach diet, Dr. Atkins diet, Dr. Stillman's diet, each for your blood type diet, each for your body type diet, raw food diet, macrobiotic diet, high-protein, low-carb, elimination diet, juice diet, breatharian diet, alkalizing diet, acidifying diet, amazing diet, maker's diet, what would Jesus eat diet, your mama's diet, yeah, everybody's diet. But you know, diets will only get you just so far. You see, because if you only search for a dietary answer alone, it's not going to answer everybody's complex problems, and that will drive a lot of people nuts. Because, and Dr. Shelton pointed this out long years before I was around, he said, diet is simply the choice of foods a person consumes. I tell my classes, I teach 3 different nutrition classes at a chiropractic college in Marietta. I tell them, okay, get ready. I'm going to give you a very complex definition of what diet is. And they're all ready to write. Yeah. I say, whatever you eat, that's your diet. That's it? That's it? So if you live on Milky Ways and Snicker bars, you're on Milky Way and Snicker bar diet. And if you eat, mung bean sprouts and sunflower seed sprouts, you're on a mung seed sprout and sunflower sprout diet. Whatever you eat, that's your diet. And I had a very obese lady come to see me. She said she was about 400 pounds, about 5'1", and she's kind of sheepish. She said, Dr. Goldberg, you're going to put me on a diet, aren't you? I said, you're already on a diet. She said, well, you just weighed me. I'm over 400 pounds. I said, yeah, you're on a very, very obese type diet. I said, you're right. We're going to have to get some weight off you. We're going to do that not by putting you on a diet. We're going to put you on a program made for you to help you get healthy, and the weight will take care of itself. See, because people think of diet as something to reduce with, right? You know better than that. A diet is whatever you eat. Whatever you eat. But people like to talk about this word nutrition. They talk about nutrition and diet as if it was interchangeable. And those terms are not interchangeable. Everything I do in practice revolves largely around nutrition, but only probably 10 to 20% of what I do revolves around diet. I look at people's microbiology, their endocrinology, their psychology, all kinds of things. That's nutrition. That is nutrition. Because you got to see the definition that was given by Dr. Shelton years and years and years ago. And I've given this definition to classes for 30 years. I taught at the University of Texas for a short time, and I've taught at Life Chiropractic College for a long time. And look at this definition that was by Dr. Shelton. Here it is. There's a lot of substance to this. He said nutrition is the sum total of all the processes and functions by which growth and development, maintenance and repair of the body, and by which reproduction is accomplished. That, ladies and gentlemen, is a mouthful. That ain't diet, is it? All the processes and functions by which growth and development, maintenance and repair of the body, and by which reproduction is accomplished. And which systems are involved with that? All of them. The nervous system, the cardiovascular system, the immune system, the reproductive system, they're all involved with that. So if we understand nutrition in a comprehensive manner, we understand that anybody, it could be your rabbi or your priest or your minister, there can be involved in nutrition too if they help you to have greater inner peace. Dr. Sabatino is going to give you a lesson in Tai Chi after I'm done here. He's going to be helping you with your nutrition by doing that. Miss Esser was talking to you about exercises before. That's involved with nutrition too. All of these things are involved with nutrition. And those are the steps in the nutrition process. And I'm not going to belabor them. I'm going to show you them quickly, and most of you are probably familiar with it. Nutrition involves what we eat, chewing it, digesting it, absorbing it, and assimilating it, excreting the waste at the cellular level, and eliminating those wastes from the bowels, the urinary tract, the respiratory tract, and through the skin. So whatever you eat, whether it's like that, over the lips, across the gums, look out stomach, here it comes, or it's like that, it's a diet. It's what you eat. And it's digestion as we break down food into smaller and smaller fat-soluble and water-soluble molecules. And absorption, where we take those nutrients and we carry them across the intestinal lumen and we actually get them into the river of life there, into the bloodstream. And then, where the tire really meets the road, where the rubber meets the road, we actually get those nutrients into the individual cells of the body. See, this isn't just what you eat, because the best of diets is no better than the worst of diets unless you get it into your system. You've got to get into the cell, and then you've got to get the waste products out. We call that cellular excretion. And according to the Max Planck Institute in Germany from years ago, there's about 500 different compounds that can be gathering in your cells, that can accumulate there. And we call getting those out cellular excretion. And then eliminating them through the bowels, the urinary tract, the respiratory tract, and through the skin. So all of that encompasses, we call nutrition.